Hello, so we have today Jessica, my esteemed medical esthetician. She's the creator of the J Glow Experience. If you haven't had it yet, call us. It's amazing. Today we're gonna use Jessica as a model for the Tech Neck Rejuvenation. So Tech Neck is something that you may have heard of already, but if not, it's basically the horizontal lines, wrinkles, or creases that are coming because we're all using our phones and looking down at devices all day. And what happens is now we're seeing patients even as young as, late teens, 20s, getting these deeper lines that would normally be something that you wouldn't see until, the late 30s or 40s. They're getting them early because they spend so much time creasing their neck looking at devices. So Jessica herself is only 30 years old, and look, she's got these lines already that are occurring, and we see it now in people, like I said, even way younger than Jessica. So her skin is going to look tighter and better and help to build that collagen with some of the treatments that we'll be using. And the great thing about it is it's a very short, you'll see 20-minute treatment that can be done all in one day. And it involves a combination of a skin tightening device called Ultherapy that we'll start with, a neuromodulator called Xeomin, which is like a Botox, and also a line filler, which is going to help to soften the deeper areas of the line. Now, in terms of what Jessica's already done, you can see she has a little bit of pinkness on her neck, and that's solely because she has used some numbing cream prior to this for about half an hour, which I recommend if you have the time. A lot of patients don't use it or need it, but that's just something you could do if you have the time. And then the first treatment that I'm going to do is the Ultherapy, which is basically using a device that's going to trigger collagen to help tighten the skin around that in terms of the neck area. Now we're going to begin with the Ultherapy portion of the treatment. And basically this involves using Ultherapy, which is a device that uses micro-focused ultrasound energy to trigger our own collagen and elastin to regenerate. The reason I'm treating underneath the chin, you may ask, is because that's what's going to pull that up in order to improve the whole look of the horizontal tech neck. So that's why I begin there. And then you'll see that I'm going to be doing some passes over the lines themselves. Now we're going to go on to the Xeomin. So Xeomin, like I said, is a neuromodulator, just like Botox. It's just one of the type of neuromodulators that we use. And what it does is it helps to relax the muscles in the neck that are surrounding these wrinkles and making them deeper. And that'll help to kind of stretch them out and smooth out the skin. So we're going to pepper a few units around these lines, and I usually do it in a zigzag manner. And I have my assistant Juliana. She's holding a distraction device that actually vibrates, and it just helps with the discomfort of the injection. All right, so Jessica, we're going to begin. And what I'm doing is I'm picking up the skin, and I'm just putting in a few units in a kind of a zigzag way, just in the superficial dermis of the skin, literally just around the lines. And I like to go pretty back because the lines start, back, and you don't want to have it, kind of all smooth and disappeared in the front and then have a visible line curving around the back. So that's why I like to do the treatments all the way around. And as you can see, it just leaves this very tiny little bleb that will go away very soon. Jessica, turn your head towards me. Perfect. And there's a lower line here that's not as visible. Make sure we get that too. And that's what you want to see. You want to see those little blebs. All right, Jessica, turn towards me. Good. And the other side, perfect. So just go back and forth to cover all the areas. And this is our last line. Excellent. Down to the final portion, which is going to be the injection into the lines of the Belotero filler. Now what's nice about this filler is it's a line filler, so it's not to create volume, it's just to help soften lines. So I'm actually going to have Jessica turn all the way. I'm not going to use the vibrating instrument on this one. And it's very superficial, so we literally want to see these little blebs, and they will all melt into the line over the next 24 to 48 hours. Now that brings up in terms of when you'll see the final results. So final results are going to be in about a week, once all the filler settles in, which usually only takes a couple days, but also giving the Xeomin that week or so to fully enact. And then the results get even better because the Ultherapy takes a while to show its results. In fact, in about a month, we often will do kind of a second treatment of the Ultherapy alone, just to give it a little more boost and long-lasting power. And that treatment literally takes minutes. Perfect, almost done, Jess. You know, you can get some like little injection marks, sometimes a little bruise that we can always laser tomorrow or later today to help it go away. If not, this is of course turtleneck season, so that's why I encourage patients to get their treatments done in the fall and winter if they want to cover up with a scarf for a couple of days if they get a bruise or something. And the results last about 6 months, which is great. So really you're talking about only doing this twice a year. To have a smooth line-free neck. So that's not much to ask. And you'll see these little blebs. That's exactly what we want to see. And those will all melt in within a day or two. And you don't, the reason, you know, we want to see these blebs is because it shows us that we're very superficial in these very superficial lines, which are close to the skin. If we didn't see these blebs, we would be too deep, and then you wouldn't get the beneficial effect of the line filler. All right, so that's the end of our Tech Neck Rejuvenation treatment. I hope you learned something about it and realize that it's a very easy treatment to treat something that's going to become more and more prevalent as we use more and more devices all day long. So Jessica, do you have any follow-up questions or anything that came up while you were getting the treatment?
You said like every 6 months this lasts for, so twice a year, like on average, you would say probably. Is there anyone that you think would need more than twice a year? Somebody who's a little older, maybe? Maybe
somebody who's older, or like a man maybe who's got deeper lines. A man will also probably need a little bit more of the filler and the neuromodulator, the Xeomin, to get the same benefit, because, you know, men just have thicker skin and those deeper lines.
Yeah. Okay.
Okay. All right. Thank you very much.